This is Insider Medicine in depth. Bathing patients who have been severely injured with cloths containing an antiseptic known as chlorhexidine can reduce their risk of developing an infection while being treated in an intensive care unit, according to research published in the Archives of Surgery. Here is some information on hospital-acquired infections. Up to half are considered to be preventable. They can result in longer hospital stays, more serious illness, and even death. They can dramatically increase healthcare costs. Researchers from Harborview Medical Center in Seattle analyzed infection rates among over 500 severely injured trauma patients who were treated in a hospital intensive care unit, before and after the unit instituted a new protocol involving bathing patients daily with cloths containing chlorhexidine. Before instituting the new protocol, roughly half the patients were bathed without using the antiseptic. After instituting the protocol, the remaining patients received daily baths using the chlorhexidine-containing cloths. Bloodstream infections related to the use of catheters were 4 times lower among those who received the chlorhexidine baths. While these baths did not reduce the rate of pneumonia associated with ventilator use, they were associated with a reduced risk of pneumonia caused by the troublesome antibiotic resistant known as MRSA. The antiseptic baths also reduced the rate at which patients became carriers of bacteria that commonly cause problematic hospital infections. We spoke with Dr. Heather Evans, the principal investigator of this study, who offered some further insight.
We were able to reduce the infection rate with some of these very difficult to treat organisms such as MRSA, and I think many people have heard of MRSA, which is methicillin-resistant Staph aureus. And we were able to demonstrate that there was a decrease in both the colonization rate, that is, when patients would have an MRSA isolated from their body but not necessarily an infection, and also the infection rate. So we had fewer infections with MRSA, both in the bloodstream and in the lungs. And so by using these chlorhexidine wipes to try and decrease the bacteria that is just on the skin of our patients, we were able to show that there were fewer of these very difficult to treat infections in the ICU.
Today's research highlights how a simple protocol using antiseptic cloths can help reduce the risks of potentially deadly hospital-acquired infections among the severely injured. For Insider Medicine in Depth, I'm Dr. Kelly Schweitzer.